Now we are looking at tubo-ovarian abscess resulting from tuberculosis. So we actually looked at tubo-ovarian abscess and we're always blaming it on what? Pelvic inflammatory disease caused by chlamydia, gonorrhoeae. Okay, but tuberculosis can also cause a tubo-ovarian abscess. Rare conditions, but let's look at it. So tubo-ovarian abscess is inflammation of what? Or collection of pus in the fallopian tubes and the ovaries. So it's rare, okay, but usually a complication of you have tuberculosis. The tuberculosis has spread to the pelvic region, okay, and it occurs when the mycobacterium tuberculosis has spread to the female genital tract, leading to chronic inflammation, calciation, and what? Abscess collection in the fallopian tubes and the ovaries. So pelvic tuberculosis arises from blood spread. Like you have a tuberculosis in the lungs, it has spread through blood to the pelvis, okay, and it is now causing inflammation of the fallopian tube and the ovaries. So fallopian tubes are the most commonly affected sites, followed by the ovaries and the endometrium. Okay, so chronic granulomatous inflammation leads to adhesions, caseous necrosis, and abscess formation. So clinical symptoms: there's chronic pelvic pain, and it could actually damage the fallopian tube, leading to what? Fertility issues, menstrual irregularities, abdominal masses. Okay, so they often misdiagnose this as pelvic inflammatory disease, but usually look out for if the person has a history of tuberculosis. Okay, so diagnosis, imaging is the mainstay. They do laboratory tests where they are trying to identify the mycobacterium tuberculosis. Okay, so management is caused by tuberculosis, so you use the standard anti-tubercular therapies where you combine drugs like what? Isoniazid, rifampicin, pyrazinamide, ethambutol. Surgical intervention, you can actually want to drain the pus or cut out the fallopian tube and the ovaries. Okay, so that's what we got.